The views expressed on this special broadcast of the Take 12 radio show do not necessarily reflect those of KHLT Recovery Broadcasting or its affiliates. KHLT is not affiliated with any particular 12-step fellowship.
A very scary experience.
You know, God is a solution. God, the 12 steps.
I like where he's going here.
Helps the community grow, helps us grow.
Monty has done a phenomenal job.
Lack of open-mindedness.
And you're talking about taking people through a spiritual process, getting them into recovery.
Thanks, Monty, and thanks for all your support.
We need spirituality to make this thing work long term.
It's an absolute pleasure. He certainly knows a lot of people.
This is one of the places that is about the business of the solution.
And now, broadcasting on location somewhere in the vast expanse of the Pacific Northwest, it's the over-opinionated 12-stepologist, the Monty Man.
Yes, indeedy. Well, how the heck are you? Welcome aboard, all you happy, peppy people. Those of you in recovery, those of you who are advocates of, and perhaps even a few of you who should be, welcome to the Take 12 Recovery Radio Show this week. It is good to have you aboard the Good Ship Recovery. I hope you're doing well. If you're not, listen, we have resources for you, some resources you may not even realize are out there. Please take down our email address. Here it is. Take 12 radio, that's the number 12, at Comcast.net. If you've got questions and we don't have the answers, we'll point you in a direction where you can get the answers. There's no reason why you cannot recover from a seemingly hopeless state of mind and body, and it's not about what you're able to do, my friends. It's more about what are you willing to do. Today on the show, it is my pleasure to have Robert Park, better known as Rob to his friends, and I hope I'm his friend. He is the Executive Vice President for Origins Behavioral Health Care. Now, some of you may recognize that name. If you're a brand new listener to the show, you may associate that with the Dr. Phil Show. Origins is considered by the executives of the Dr. Phil Show, many other folks, and us here at Take 12 Radio as well, as the gold standard in recovery treatment. And we're going to be talking about that. We're going to be talking with Rob. I've got some questions for him concerning things like dual diagnosis. What's that mean? Co-occurring mental health issues. What's that about? Let's talk about insurance and parity. And you're going, wow, I don't know what you're talking about. Well, I want to help to enlighten you a little bit, and I can't think of a better person to have on the show today than Rob Park. Rob has been involved with the field of addiction recovery in a variety of capacities for most of his life. From working as a director of admissions to being more directly involved with patient care as a case manager, he embraces a holistic approach to healing both mind and body and believes strongly in the Origins experience. Being a recovered addict alcoholic himself, Rob understands that personal experience is an essential part of someone's ability to help others achieve sobriety, and that you cannot transmit something you yourself do not have. Rob is a licensed chemical dependency counselor, and we're going to be talking to him about all sorts of things that go on at Origins and what his passion is and the whole nine yards. Rob, welcome to Take 12 Radio, my friend.
Man, I'm so glad to be here. Thanks for having me on the show.
Absolute pleasure. You're a busy guy. You just came back from you're not home yet. You're not back in Florida yet, are you?
No, I'm actually on the other coast right now, and out here for another Dr. Phil show, and then head back tomorrow back to Florida. So.
Yeah, right. So you got a call at the last minute to come out to California to tape a Dr. Phil show, and then you're heading back. You're a busy man. but it doesn't slow you down. The team at Origins is an amazing team, right?
We have an amazing team. It's really humbling to sit around the table with these folks and just witness their passion and heart and energy they put into the work they do every day.
So Rob, just to kind of qualify for the listeners, life wasn't always, going as well for you as it is now, true?
Never gone this well for me. Yeah, I'm in recovery. I've been sober for 11 years. Just celebrated a birthday on June 26th of this year.
Wow.
And and I was what you call one of the trash can junkie kind of thing. At least that's what I was told when I got the treatment. If you had it, I wanted it, and I wanted more of it. But mainly, I used a lot of cocaine and a lot of benzodiazepines and alcohol, and I like to have all three. I was very big into combining things. So. Oh
yeah, well, you were all inclusive. Good for you.
Yeah, I didn't want to be prejudiced.
Well, and here you are now, though. Do you pinch yourself sometimes and go, "Is this really going on?"
It's like another lifetime. It's it just before I got sober, it seems on one hand it's very real, and on the other hand, it's almost like a dream, and. I feel like this is who I'm really supposed to be. This is who I am. I finally arrived into kind of grow into the person that God created me to be. So,
yeah.
But yes, I mean, the fact that I'm an executive vice president of a world-class treatment center, that I'm on a TV show, that I'm talking to you on the phone right now, is amazing and surreal sometimes. Yes.
Yeah, you bet. And if somebody had told me I'd be sitting behind a microphone and doing this for the last 11 years, I would have just said, just crack open another beer and dream on, buddy. But,
exactly.
But God has plans, and He's not hindered. He's going to do what He's going to do. Thank goodness for that. Well, one of the things that I just love about Origins, the facility that is on South Padre Island, is that it's on an island. And one of the jokes that Ben Levinson and I talk about is that when parents drop people off, or when they get ready to, they say, "Is this really on an island? Does that mean my kid's not going to be able to get back so easy?" That it is true. It's on an island, right?
It is. Yeah. It is kind of a joke, and there is some truth to it, of course, too. I mean. Yeah, there's a long 2.5-mile causeway from the mainland to the island, and you can't walk across the causeway. And it's a really long swim. So and it's a gorgeous setting. So
right. Well, listen, it's been a year, and just so the listeners know, Origins is our exclusive sponsor of our Circuit Speaker Monday show. And they help to sponsor our other shows as well. If it wasn't for folks like the folks at Origins, Take 12 Radio wouldn't be able to broadcast. And so we're so grateful. But since we have talked and had Origins on the program, Origins has grown a great deal. You guys have got your hands in a lot of other areas other than South Padre Island. Tell us about some of these.
Monty, first let me say it's a pleasure to be a part of your show. We really believe in what you're doing, and we're all about carrying the message of hope and recovery, and that you can recover. And you're on the exact same page as we are, and we're honored to be a part of this show.
God bless you.
Yeah, so we acquired 2 facilities, both of them in Florida. One in West Palm Beach, Florida, and the other in Vero Beach, Florida. And one is called the Hanley Center, and that's the one in West Palm. It is a 80-bed facility, and it's been there for 30 years. It was originally a Hazelden facility, and then it's kind of gone through a myriad of different owners, and But it's been a staple there, and been probably the most respected, and is still the most respected full residential center in Southern Florida, which, Southern Florida kind of has a rep for a lot of different things.
Yeah.
Hanley has really stood the test of time there. And we're doing a lot of cool things. I mean, for one, they were doing a lot of things right, and we organized and tweaked some of the program stuff, and which has been a lot of fun. Worked on culture and really implementing our 12-step immersion, which is very unique in the treatment world. And then we have a facility called Gate Lodge up in Vero Beach. It's a smaller facility. It's only got 20 beds in it. It's mixed gender. It's a cool program because it's so small. We can really tailor individuals' needs. I mean, so people will come there and, for primary treatment, and they'll stay for 6 months, and they'll end up getting a job while still living in that center. We have the ability to really flex what we're able to do there. And the other thing that's nice about it is a lower cost. So the thing about Gate Lodge, it doesn't have as many bells and whistles as Origins in Texas and Hanley Center in West Palm has, but it has the nuts and bolts.
So you said something key, and this is the elephant in the proverbial elephant in the room for a lot of people, because I do drug and alcohol on Tuesdays and Thursdays out at a facility here in Lynn County. I do drug and alcohol assessment and referral. Let me ask you, how important is it that we find out if a person is truly an alcoholic or a narcotic addict, or if they're just a heavy drinker or drug abuser? That's important to find out the difference, isn't it?
It's imperative. And, it's really, when we talk about step one in our Big Book lectures, it's our job, and I'll paraphrase what Bill Wilson says, to give the newcomer an adequate representation of what the program is. And that includes defining what it means to have alcoholism or to have addiction, to really talk about the physical, mental, and spiritual effects. And then, if this is something that seems right for you, and you have that first step experience, or it fits your innermost self, but yes, this is you, then we've got a solution for you. And if you don't fit that, maybe you're drinking or using because of an issue or because of depression, anxiety, maybe you had an injury and got addicted to pain medication, it's still a physical addiction, and hey, we've got an answer for that. It's just a little different.
Right.
And it's important to put people that really are the real thing and gear them towards the 12-step fellowships. And the others, that's where therapy comes in. And there's support groups for that too.
Mm-hmm.
But if we start putting people in the rooms that are not really alcoholic or addict, it gets confusing for the newcomer.
Yeah, it does. And so going back to the elephant in the room thing, so, and I know you get this all the time. I certainly do. So I'm sitting down with somebody, and, it's obvious this is more than just a heavy drinker. This is more than just somebody who's dabbling around with marijuana and maybe snorting a couple lines of cocaine once in a while. This is somebody who is not just an abuser. This is somebody who is actually somebody that has the allergy of the body and the obsession of the mind. And we know that in many cases, they're going to need holistic treatment. It may not be enough for them to simply go to their 12-step support meeting and try and work with a sponsor and so forth. They may need additional help. In many cases, that is true. And they're looking at me with these eyes of desperation, and what I see looking back at me is dollar signs with a question mark. And I feel so hopeless sometimes because it's easy for me to sit at my desk at my other office and say what I said at the beginning of the show. It's not about what you're able to do. It's about what you're willing to do. But that's easy for me to say. But the cost thing is a factor, and I think we've been talking about it for a long time with treatment facilities and insurance and parity and all that kind of stuff. But it's still a factor, is it not?
Absolutely, it's a factor. Yeah, I mean, in all of our healthcare, but I mean specifically, what we're talking about today. Yeah, it's a big factor to get the best help. It's expensive.
Because what I've seen is I've seen people, and I'm sorry, listeners. I know some of you are probably going to be angry with me about this, but there are facilities that really aren't qualified to treat certain people. They're just not. Their heart's in the right place, but they're not. And what happens is you end up paying a lot of money to go to one of these places, and it doesn't work out well. And so then they go to another one of those places, and it doesn't work out well because they haven't been diagnosed properly. Perhaps they are in need of, it's a need of a dual diagnosis center, which you guys are, right?
Yeah, we are. The problem is everyone says they're dual diagnosis, even if they're not. I mean,
yeah.
But yes, we are a dual diagnosis center. I mean, we have 2 psychiatrists in Texas and 2 psychiatrists in Florida that are on staff, that, are there every day. And, it's not like a once-a-week thing. We've got psychologists. We do, 3 different psychological tests. We've got master-level therapists. So we have the resources to truly treat things like dual diagnosis, a psychiatric co-occurring disorder. But yeah, I mean, to your point, I mean, yeah, it's unfortunate, and more and more people, including myself, Google things, and, we go to the internet to look for, services, and people do the same thing with addiction treatment, and the internet is a horrible referral source.
Oh, boy.
Anybody can make a website and say, we do X, Y, Z. They can put a list of staff on their webpage that maybe, they're at the center, maybe they're not at the center. And you have, big money coming into this industry that spend a lot of money on getting their website to the top of the page, and really, a lot of pressure to put heads in beds. And so it's not uncommon for people to say things that may not be true in order to get a person into their treatment center.
Right. Unfortunately. Yeah. Yeah.
Unfortunately.
And that's one reason why we have such high respect for you guys. We are very picky about who we hitch our wagon to, and because we're talking about people's lives here. You can't screw around with that. There's no time. It's like that phrase, go to 90 meetings in 90 days. Well, what gives us the right? What gives us the right to think the poor sap's got 90 days? He could be dead tomorrow. And we want to say, oh, you'll get step 1 in about a month. What? I'm like, okay.
Monty, if I may, just to that point, we get people that come to Origins that have been to 2, 3 plus treatment centers, and they'll come and listen to how we talk about the 12 steps and how we don't use necessarily things like 90 meetings in 90 days and meeting makers make it.
Right.
We're talking about do the work and get connected, and we talk about how you can recover and, go out there and have a kick-butt life. And they're like, how come no one's ever told me this before?
I know.
Anyway.
Well, it just proves that there's a lot of people, in my own 12-step home group. I'm sitting there the other day and I'm hearing, well, I really don't work the steps, but I sponsor 6 guys, and and somebody's like, well, I never really opened the book, but I'm doing okay, and but my life sucks, and I'm looking down at this table, and there's all this literature, and I'm thinking, why is that even there? Yeah.
Yeah. Well, more power to them. Pardon the pun. I mean,
yeah.
Yeah,
really. Yeah.
Everyone has the right to work the program however they want to work the program. It's just if you want the full benefits of it, there's certain things to do. But like you said, if you're sharing things like that in a meeting, of course, the newcomer is, going to be confused about that.
Yeah.
And that's where we really fail at.
Yeah, I hear you. All right, we're going to take a break, and when we come back, I want to touch a little bit on the co-occurring mental health. Somebody asked me the other day, well, not just somebody, about 6 different people emailed me in one day concerning the phrase co-occurring mental health issues. They're kind of confused. What does that mean? So I want to ask you your opinion on that, and talk a little bit about insurance and that kind of thing. Folks, don't go away. More with my guest, Rob Park. He is the Executive Vice President for Origins Behavioral Healthcare. He's also the Executive Director at Hanley Center. Don't go away. We'll be right back.
Origins Recovery Centers provides integrated inpatient treatment for substance abuse and co-occurring disorders. At Origins, clients receive expert medical, clinical, and spiritual care individually designed for their needs. Our clients leave Origins with the foundation upon which they will build the rest of their lives. Call now to speak with an admissions specialist. Our toll-free number is 888-843-8935. That's 888-843-8935. Origins, delivering real solutions for real families.
There I was in my business suit, all dressed up, just uptight as I could possibly be. And I don't remember much of what was said at that first AA meeting. It was more the feeling of the meeting itself.
That's what has kept me going. I know it works, and I see the people ahead of me with more sobriety. I see how happy they are, and I want that. I want that too.
And what I notice about AA is it sort of helps me to relax and learn to really be happy with my sobriety. It's a richer life to live.
That's exactly what Alcoholics Anonymous does. It teaches us how to live without drinking. It teaches us how to have fun and really enjoy life without drinking.
This program's given me the good life. The only good life I've ever known.
Alcoholics Anonymous. It works. Look us up. Check your phone book, newspaper, or AA.org.
This is Chris Schroeder. You are listening to Take12Radio.com. Recovery talk and positive music.
No, I won't be afraid. Oh, I won't be afraid. Just as long as you stand.
Well, welcome back to the show. Standing by you. Standing in the gap for you here at Take12Radio.com on your internet dial is our email address, Take12Radio@Comcast.net. Use the number 12. If you've got questions, we would love to point you in the direction to where you may find some of those answers. We may have some ourselves, but if we don't, we will point you in the direction where you can get those. Please do not be shy about that. Executive Vice President for Origins Behavioral Healthcare, Robert Park, is my guest today, and we've been talking about a lot of different issues. One of the questions that has been asking me in the last couple of days is, what exactly is a co-occurring mental health issue? What is that, Rob?
Well, I mean, a co-occurring mental health issue. I mean, so it could be psychiatric in nature. From anywhere from a schizo diagnosis to a depression, anxiety, bipolar, all of those things. And now, co-occurring mental health, I mean, can also be, some trauma. It could be unresolved grief. So all of those things that couple that can happen to people, anybody, any person, but then also have a substance use disorder as well. So, I think that one of the things we have to be careful about is addiction manifests as depression, anxiety, loneliness, mood swings, all of these things. So what's important is to be able to not slap diagnoses on people, and be sure, be clear, and do the proper assessments, and monitor them over time. Not just introduce them to medication, but really let's turn over every rock and take an honest look at it, and and see what we find. And, like a lot of people will clear up, and their depression lifts as they engage in a program of recovery, and their anxiety dissipates. So having said that, I mean, there are a lot of people that show up to treatment with something going on, co-occurring to their substance use disorder.
Yeah, I mean, let's face it. You've been shoving methamphetamines into your bloodstream and down on Wild Turkey 101 for the last 18 years, and you stop doing that, you're probably going to be depressed.
Yeah, I mean, I would say your receptors are probably a little weak. I mean, and so, yeah, I mean,
so you got to be careful.
We do use medication. We do use psychotropic medication. We're conservative, but we use it when appropriate. We also have a lot of non-pharma interventions. We have our neuroplasticity programs where we directly treat the brain with bio and neurofeedback that can help with sleeplessness, can help with anxiety, can help with depression. So, I mean, there's a lot of different things that we can do to help expedite the natural process of neuroplasticity.
Now, when somebody comes into Origins, many times they got a lot of stuff going on. So you have co-occurring mental health issues. You've got diabetes. You've got obesity, malnourishment. I mean, and one of the things I love about the people that we try to promote on our show is this whole idea of being holistic, because not everybody is holistic. There's a lot of people out there that are just treating this thing as a clinical issue only, or just as a spiritual issue only. And they're not treating the whole person. And I just want to congratulate you guys for being one of those that absolutely does do that. So we're talking about mental and emotional sobriety. We're talking about nutrition. We're talking about maintaining a proper medication level depending on what you need, even for diabetes. I mean, it's all inclusive. We're talking about a spiritual relationship with the Creator, wherever you are in your journey. You guys nurture all of that, right?
Yeah, we do. It's really, when we created the program, we wanted to take the best of kind of all aspects and truly be holistic. Every one of our clients that sees a doctor every single day they're in treatment, even if it's for 5 minutes, and just checking in with how their health is doing, how their diet's doing, are they working out, how are they sleeping, how's their sleep hygiene. They're meeting with their 12-step experts on a daily basis. Just, hey, where are you at in steps? What's going on? And then meeting with their therapist as well on a daily basis. So, yeah, I mean, I think it's what a cool opportunity for, and that's what I tell the people that are in our treatment centers all the time is that what a cool opportunity to be able to come here to get to not have to worry about work, to not have to cook a meal, to have a place to sleep, and to be surrounded by caring professionals that are in your corner that want to help you to recover from addiction. And, not everybody, a lot of people take it for granted, and it shouldn't be, because, we've evolved so much in this field to understand, truly how to treat this thing, addiction, in better and better and better ways. So
you bet, you bet. And before I tackle the insurance question, and what some of your thoughts are on that, I had, or I'm having on the 18th, Greg Seward. He is the one of the directors and educators, master level educator at the University of Massachusetts Memorial Medical Center and Medical School. His specialty is tobacco, and and he was he's a little unhappy with a certain conference presenting organization because he's applied for 3 years in a row to talk about addiction to nicotine, and they've turned him down, and nobody's talking about the addiction to nicotine at these some of these conventions and symposiums. I feel his frustration because that's a huge piece, isn't it?
Yeah, I think it is, and you're right. I mean, I think everyone is kind of another elephant in the room, so to speak. I mean, it's just. I mean, you kind of, if you think about an AA meeting, I mean, you think about coffee and cigarettes a lot of times. I mean, unfortunately, but it's absolutely a problem. I don't think our industry is, really ready to address it, quite honestly. I hope that we are soon. Because, I mean, the research has been done. I mean, sobriety rates, shoot through the roof when you quit smoking and quit using other drugs at the same time.
Yeah. So it's a good idea to quit it all at the same time then, is what you're saying, if possible.
According to the research, and I would understand why. I mean,
Yeah, you bet. All right, let's talk about insurance for a minute. I was sitting I was invited to sit in on a board meeting, a rather large board meeting. I was listening to a discussion about parity and about insurance companies, and it was the same discussion I've been hearing for years. The new piece about it was the parity laws, and it seems like we're just kind of preaching to the choir. One of the ladies that was there made the statement, the question, she said, when are we going to start to realize that we have to stop depending on the insurance companies to be on the same page with us? Can you comment to that statement for me?
I think that's the way it is with all medical professionals or mental health professionals. Is the insurance companies don't want. We have different motives. I mean, quite honestly, we have and so I think I don't think it'd be wise to try to get them to I'm assuming what she was talking about is residential treatment.
Yeah, she was.
I mean, yeah. So, you have all this research out that a lot of drug companies are putting out, with medication-assisted therapy and outpatient, and there's a big push towards outpatient and lower levels of care, rather than residential. And, it's cheaper. For one, it's cheaper for the consumer and it's cheaper for the insurance companies. But, you don't have that same level of immersion into recovery and it's like being in a residential treatment. It's like being in a hospital.
Yeah.
You have all your specialists there. That's why you go to hospitals, and so I think there'll always be a place for residential treatment. But I think I'm not inside whoever that said that said, but I would assume she was saying that as an industry we fight for 30 plus days of residential treatment to be authorized by insurance companies, and they don't. And in actuality, they probably authorize 10 days, 20 days,
Mm-hmm.
Somewhere in that range of RTC residential treatment level of care.
So what I'm thinking is that a lot of the finances that are raised to pay for residential treatment, it would certainly be helpful if we had a lot more private donors, I would think. Yeah.
I mean,
in the perfect world.
Right.
Yeah, because it's a battle. That's for sure. Okay, we're going to take our last break.
Some insurance companies are better than others,
That's true.
And there's a lot that goes into it. I mean, it's about doing the proper assessment, doing the documentation, being clear and concise about what the person is presenting with, what the problems are, what the treatment plans are, using different sets of criteria, and then articulating that to an insurance company utilization review process. And it's not easy. I mean, but we have MDs that actually do all of our utilization review for us, which has been very beneficial for us. Because there is a doctor on the phone that are fighting for the people we serve to the insurance companies, and they do pretty good.
Yeah. Yeah. All right. We're going to take a break. When we come back, I do want to talk a little bit about medicated assisted treatment. Folks, don't go away. More with Rob Park. He's the Executive Vice President for Origins Behavioral Healthcare when we return.
This is Dr. Al Mooney, author of The Recovery Book, and you are listening to Take12Radio.com.
As men and women who have recovered from utterly hopeless states of addiction ourselves, we know all too well what it is like to battle addiction daily. We are Origins Recovery Centers. Here at Origins, we have taken that which we have learned along the way, excised anything unhelpful and unnecessary, infused it with the latest in medical research and innovative therapeutic methods, and created what we know to be the absolute gold standard in substance abuse treatment. And Origins provides the most preeminent aftercare and relapse prevention program available in the United States. For a free, confidential clinical assessment, call toll-free 888-843-8935. That's 888-843-8935. Origins, delivering real solutions for real families.
Welcome back to the show. You've tuned in to Take12Radio.com on your internet dial. You can find us all over social media and social networking, Facebook, Twitter, Google+, YouTube, LinkedIn. The list is never ending. Welcome back, everyone. Rob Park, Executive Vice President for Origins Behavioral Healthcare, is my guest this week, talking about treatment, dual diagnosis, co-occurring mental health issues, addiction, recovery. Origins, in the opinion of many, and we are included in that, is the gold standard in treating addictive illness. And we are so proud of them and so glad to be associated with Origins. In the news for quite a while now, particularly in kind of underground movements like the Fix, thefix.com, and some of these others, we are seeing a lot of talk about medicated assisted recovery, particularly Suboxone, Vivitrol, and some of these others. Tell us about medicated assisted treatment. Is there do we really know enough about it? I mean, is it going okay, or are there problems?
Yes to all of those questions. I think, at Origins, we don't use any maintenance drugs. In particular, we don't use buprenorphine for maintenance purposes. But I think let me say this. I don't know anybody that has been successful in a buprenorphine maintenance program. But they exist. I just haven't met one. So apparently they exist. I mean, I think I don't think it's necessary. I don't think that there's a reason we don't do it at Origins. But if you're going to do it, I think there's a way to do it. And that, includes a lot of support and a lot of therapy, and it requires it requires a certain plan. There's got to be an end date. There's got to be, clear cut, kind of like, okay, this is the treatment plan, and this is what we're going to do. So I mean, I'm not going to say it's horrible and no one should ever do it because I don't know what's best for everybody.
Right.
At Origins we stand for something, and we're not afraid to stand and kind of put our flag in the ground and say this is who we are and this is what we believe. But other people are other people, and that's okay too. So I mean, I don't think we know enough about it. I just don't think that it's been around long enough to know everything about it. The problems are that people are just on these drugs indefinitely without a plan, or sometimes without even therapy or anything like that attached to it. It's just, okay, take the drug and see you later kind of thing.
Yeah.
People abuse it. People are just using it for in-between fixes. So, they can't find any heroin or something along those lines. It's like, oh, well, then do you have Subutex? Because I'll use that. Because, at all costs, they don't want to get sick. And then they're just kind of using it as a gap in between using heroin. And so, I mean, I think those are the problems. I think where we've seen some of the success, that's, you know, in some people's minds, I think it's success is when you use it with a clear-cut plan, with the proper support, and all of those things. So the only place that we use, and most of the centers that we associate with use buprenorphine, is in the detox phase of opiate addiction. So, you know, kind of quick tapers, 5 to at the max 10-day tapers.
Right.
Yeah, just to land people softly into treatment. So.
Well, and you know, I don't want the listeners to get me wrong. I'm all for making a person as comfortable as they can possibly be. I've been through opiate withdrawal. Not that it was ever my drug of choice, but I had both hips replaced here a few years ago. Contracted MRSA twice. I had to have a PICC line going to my heart. I mean, it was horrific. And
wow.
they had me on opiate-based pain medication for over a year, Rob. And I had never experienced, I was Mr. Go chemical guy. So that never was in my bag of tricks. I didn't know anything about it. And when I got to the place in my recovery from these surgeries and from the MRSA, where it was time to wean off of these, it was the most horrific experience I've ever gone through in my life. Clonidine, I think, it wasn't Klonopin. It was Clonidine, I think, they gave me towards the end there because I was so sick, and that helped a little bit. But I got to tell you, I gained an appreciation for opiate addicts like I never had before. So I get making somebody comfortable, but what I'm seeing is a lot of people. There's a center up here in the Pacific Northwest. They'll use Suboxone, but they don't even discharge the person that's there until they have completely weaned off the Suboxone. They won't even let them out.
Right.
And I'm like, hooray, good for you. Because what I'm seeing is a lot of people running around leaving treatment and, 30-day treatment centers, and they're on these medications, and no one's done anything to get them off of them. And I'm just, that's very frustrating.
Yeah, I hear you, and I agree. And you have your outlier cases. I'm talking 1 to 3% that, like, for instance, we've had a 6-year-old opiate ID heroin addict.
Yeah.
Which there aren't many of those because they're either sober or dead at that point.
Yeah.
But his receptors are so shot that he was a candidate for a little bit longer of a taper. Again, right. And he needs to stay in treatment and taper off that drug and then have some time away from the drug because there's a withdrawal from that. And then really be, drug free to finish his treatment. But I agree. I mean, it's obviously it's a big topic
in
the industry.
It is.
Yeah.
It is. I want to touch on something that's going to be real controversial for a lot of my listeners, but they know me well enough. They know I'm overly opinionated. Let's talk about marijuana. Okay, so as well as I do, it's all over the place, but it's been all over the place for a lot of years. It's just now openly all over the place. Oregon has joined the ranks of the state, one of the states that has legalized it for recreational use. I got to tell you, my kids, my sober children, they drive their cars out there, and I really don't appreciate the fact that there's other people driving out there under the influence of cannabis. Not too happy about it. But having said that, have you guys seen is there an increase? I mean, maybe it's too soon to tell. Is there an increase of people with marijuana addiction coming into treatment because of the legalization of marijuana, do you think?
Honestly, Monty, we haven't seen it yet.
Yeah.
I think, if we had some centers in California or in Oregon or in Colorado, that may be different. But, where we're at, I don't think we've seen a huge increase of it. Yeah.
The thing that concerns me, and see what you think about this, is there were certain things when I was growing up that I just didn't do simply because they were illegal. Now, I certainly broke a lot of laws anyway, So, I'm not a Puritan. But there were some things I didn't do when I was in high school, for instance, because they were against the law. If they had been legal, perhaps I would have, fiddled around in those areas. And we know with the amount of people, what is it, the 1 in 5 or whatever that are already addicted before they put it in their bodies kind of thing. So somebody here, there's no problems. Something's legal, they put it in their body, and boom, they're off to the races. Whereas perhaps if it wasn't legal, that wouldn't have happened. I don't know. It's a real mess out here in the Pacific Northwest. I don't know that we know that enough about this whole thing to be just, signing off the legalization of this, that, and the other thing every time we turn around. But it certainly does make an interesting conversation with everybody you meet.
Yeah, there's a lot of opinions associated with this thing, and it is always interesting conversations around it.
I guess I'm amazed. I guess what blew my mind is the amount of people within the recovery community that were so pro legalizing pot. And I guess it just caught me off guard.
Yeah, I mean, you would think that the people that have experienced addiction and that are now in recovery would not be pro legalization of a mind-altering substance just to, kind of further the access to a drug.
Right.
I can really see both sides of it, honestly.
Yeah, I can too.
And that's just kind of how I am, though. I try to see both sides of everything, and that's just the way that Rob Park operates. But I wouldn't say that I'm pro legalization, but I mean, it's going to be interesting. It's going to be interesting to see what happens.
Let's talk about the MAPS program. Okay, because this is really important. I mean, this is like majorly vital, isn't it? The aftercare, the follow-up of somebody once they leave a facility like any one of the Origins behavioral health care facilities?
Yeah, I mean, one of the things that we've led the charge on in recent years is developing a model of treatment that treats a chronic condition. We've been treating addiction in the treatment industry for, decades as an acute problem. And so we wanted to offer every single person that comes into our program a minimum of 15 months of aftercare. It's included in the cost. So whether you want it or you don't want it, it's
there.
It's not going to change the cost of treatment.
Right.
That's because we just believe in it. And so, yeah, I mean, what's cool about it is that we're getting a lot of really valuable information from all the aftercare, from the people that we're talking to 15 months after they leave our centers. And we have these really built this amazing software that's able to track a lot of different things. We're including the family in the aftercare, which is a huge piece of this.
Yeah.
If we look at our recovery rate, we have several factors that we look at to get a recovery rate, and one of the main factors in that is family, is the family system. And when we see people start to decline in their recovery rate, their family issues are always one of the first things that rise. And it's interesting, So we talk to the whole recovery system, anybody that's in that person's life. So sponsor, therapist, mom, dad, wife, husband, sister, brother, etc. And really also, I mean, the other piece of that is we want to make sure that what the person in recovery is telling us is accurate. So we're cooperating information and just making sure, that what the data that we're getting is truth. Because, how we used to do it is we call, in this industry, is we call people 6, 30, 90, 6 months and a year out, and we call them and we say, hey, are you sober? And we're like, oh, great. We look at our success rate. It's amazing.
I know.
And
I'm sorry. That just cracks me up.
I just envision this, this person answering the phone with a a little highball, a nice short glass of whiskey. Yes, I am. Or they're back on the Xanax or Klonopin,
right,
Adderall, or whatever it is. So, oh man, yeah. I mean, it's unique. MAP. There are a lot of treatment centers that are working with the MAP program now.
Yeah.
And MAP does so much more now than recovery support. They're also really experts at utilization review, and they do billing and verification of benefits. And so they've expanded into a company called MAP Health Management, and they're working with treatment centers all over the country, offering the recovery support services, and then some. So.
Yeah, amazing. That's just great. We're almost out of time, and one of the areas that we really didn't focus on, which I really wish we had more time to, is the family. But let's really quickly let's talk about that. Many times the family is sicker than the addict. True? Yeah. And that's a hard one to communicate. I mean, I can't tell you how many times people sat in my office and I'm looking at them, I'm thinking, oh man. The meth addict head over here, he's not the problem. Mom and Dad's the problem.
Yeah, I mean, addiction sometimes is easier to treat than some of the issues that arise in the family of origin. Yeah, I mean, it's the old kind of dynamic where the person with the addiction is the scapegoat, and everyone's just projecting, all of the problems onto that person. But everyone's got three fingers pointing back at them, of course. And so it's about separating the addiction from the person, people understanding how they've contributed to the problem, and then taking responsibility for, how can they change? How can they get well? Because inevitably what happens is the person with the addiction starts to get well, and the people that are in the family system just crater. And they, that's what we see all the time, that they don't have anything to project their pain and their issues onto, and they really come out sideways a lot. And so the hope is that everybody gets engaged into a recovery program, and we believe that everyone has actually been called. Hey, you know what? You haven't experienced this addiction or this person in your family, the addiction system for no reason. There's an important reason that you've experienced this. You've been called to get well and to carry the message of hope to the other people out, the other 24 whatever million people it is in the United States and beyond in the world.
Yeah, good point. Because if everybody's sitting around helping the active addict or alcoholic and no one's helping the family, we're going to be in deep weeds. Because as well as I do, if Joe or Mary return to the same environment they came out of, it's not going to be a pretty thing.
It's already an uphill battle, but
yeah.
You do that, and then it's just like, I mean, it's really exponentially more difficult.
If the listeners don't believe us, all they got to do is watch an episode of Dr. Phil and watch the family's reactions versus the addict's reactions. They'll be convinced right away that this isn't just an addict saying, this is a family deal.
It really is. I mean, we've been saying that for years. It's just the truth.
Yeah.
It is. It's just the truth. I mean, the enabling and the codependency and the anger and the resentment and, control and all of those things that come along, or I should say the illusion of control, that come along with this peculiar disease that's like no other.
Yeah.
It's really an extraordinary affliction, and life in recovery can be extraordinary.
It can, and that's the good news. That is the good news. Listen, if you want more information about Origins Behavioral Health Care, and you want to learn and talk to some people about some good news, the website is originsrecovery.com. You can go to our partners page at take12radio.com, and you'll see the huge banner. Click on it. That'll take you to Origins. Talk to the people there. That's the good news, is that there is healing. There is reconciliation. There is the rebuilding of brokenness. Addiction is a disease like no other, but the recovery from it can be a recovery like no other. Rob, thank you so much.
Hey, thanks for having me. It's been a blast. I've had a good time.
Rob Park, Executive Vice President, Origins Behavioral Healthcare, has been my guest this week. Rob, any closing thoughts and remarks?
I just, really, to your listeners, there is all sorts of different help out there, Origins or somewhere else. It's even if you don't feel like you need to go to treatment, or you want to go to treatment somewhere else and want an opinion, our admissions department is really truly a resource. Like, we just want people to get help, and we want to connect anybody with help. Call us, and we'll help connect those dots wherever you are and whatever it is that you need.
Excellent. Excellent. Amazing. All right, folks, don't forget, originsrecovery.com. Follow the links here at take12radio.com. It's been a great interview, a great show, very informative. It's been an absolute pleasure and an honor to have the Executive Vice President for Origins Behavioral Healthcare, Mr. Robert Park, on our show this week. Folks, don't forget to check out our website, our YouTube version. All of our shows are on YouTube now. All our archives are there as well. Until our next broadcast, this is the Monty Man, along with my guest, Rob Park, and we're wishing God's perfect serenity for you. Bye-bye now, my friends.
This has been a broadcast of KHLT Recovery Broadcasting.
Kitty, 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 kitty.